the sequelae of post-inflammatory hyperpigmentation, which can have as much of an impact on patients and sometimes even more of an impact on patients than the primary inflammatory or non-inflammatory lesions. Uh, Acne scarring, and then the psychosocial impact of having acne. And so we have all of these other dimensions beyond just narrowly focusing on lesion counts.
You mentioned the psychosocial aspect of acne. It's something I think about pretty much every time I see a teenager with acne, because we know from earlier data, again, data that is largely generated by Galderma, that when a teenager develops acne and the effect it has on their self-esteem, it's not like once you clear the acne, the self-esteem will immediately rebound. Unfortunately, we know from this data that the effect on confidence and self-esteem actually persists throughout adulthood as well. So that I always think about that, because when I have a teenager with significant acne, I think about how it's affecting them psychosocially and now and in the future, and how, boy, that puts a huge onus on us to get them better quickly, because the last thing we want is for them to be dealing with the psychological aspect of acne 10 to 20 years later.
Yeah, well said. And with that in mind, I think it's helpful for us as clinicians when we take care of our acne patients, particularly in the initial consultation, but really throughout the acne journey, to take one extra moment and ask our patients, assess how the acne might be affecting them in their social lives, professional lives, their overall self-esteem. And we can glean a lot of that, even if it's not said verbally. There are also many nonverbal cues, aren't there? We can see when we walk into the room.
Yeah, it's tough to be a teenager in any way. And then you add significant acne, and it just makes that journey even more difficult. I was lucky as a teenager. I just didn't experience a lot of acne, but I remember my friends that did, and what a struggle.
Yeah, not to overshare and get too personal, but I'll just, in response to that context, I can say that I certainly suffered from acne throughout my teenage years, and even through my early 20s, and was treated during medical school too. So,
yeah. Well, let's jump into kind of. I'd love to actually get your thoughts on how you best utilize Triferatine in your just daily practice, and where do you find it slotting in, and it's being the most successful for you, because I think that kind of takeaway will be huge for our audience as well.
mm-hmm. Yeah. So, first of all, taking a step back, I view retinoids as really the foundation of our approach to treating acne. And so the ability to use an advanced retinoid, this fourth generation retinoid with RAR gamma selectivity, with facial and trunk data and some other data that we're going to talk about, it's really become one of my go-to retinoids when it's accessible for my patient. So I'll frequently use Triferatine, have my patients use Triferatine at night, and whether it's on the face or face and trunk, depending on their involvement. And then for the morning, even though the clinical trials demonstrated monotherapy, demonstrated efficacy with monotherapy, in the real world, of course, we will combine multiple agents to try to target multiple etiologic factors, pathogenic factors for acne, and increase the overall efficacy. So I might have the patient use a benzoyl peroxide clindamycin formulation in the morning, coupled with the retinoid at night. They might use a topical azelaic acid formulation if their sensitivity to benzoyl peroxide, or if there's a sort of urgency to work harder on the hyperpigmentation front, and having two agents working on hyperpigmentation at the same time, the retinoid and azelaic acid. These would be some examples. Or the clascoterone, another one of our newer agents, in this case targeting the sebaceous gland and inhibiting an androgen receptor there. That's also potential combination of retinoid at night and clascoterone in the morning. So there are many different combinations that one can consider on a case-by-case basis, depending on the clinical severity, the predominant types of lesions. And this is not to exclude oral therapies. So there are scenarios where patients will have more severe acne and will combine topical regimen, including Triferatine, with an oral agent like doxycycline.